and would be if the people east of us had voted a little bit better than they did, and maybe they'll get it right next time. She want health care because they were on their way to the We Don't Want Health Care rally. So, Andrea.
Thank you, David. Thank you. Thank you, Anna. Thank you, Leslie. Thank you, everybody, for coming. As David said, my name is Andrea Miller, and I ran for Congress in the Virginia 4th District. So I am right here in Virginia. And one of my big issues when I ran for Congress, and it is still a huge issue, is health care. And when we talk about the robber class and we talk about the robbed class, nowhere is it more obvious that this is going on than in health care. When you look at the health care industry, when you look at the bills that they currently have in Congress that are allegedly going to help us with health care, where they have mandated health care, where people will be forced to buy health insurance. Now, I am sure that everybody sitting here knows health insurance and health care are not the same thing. I normally explain to people, and I said, now imagine this. Imagine you went to a really expensive 5-star restaurant. You ordered, and then you paid. Now, the deal is, you don't know if they're actually going to bring your food or not. All right? But you have to pay first. And maybe you get served, and maybe you don't. That is the American health insurance system. And that's the way it's been for 60 years. And it is getting more and more and more. We pay more, we get less. Now, for all those people who really support single payer, let's give single payer a hand. Basically, they're saying 119 million people probably want single payer, and they just don't know what it is. All right, they really don't. So when you say single payer, most people say, oh, right, yeah, no, we don't want that. And then when you explain or ask the question, do you know what Medicare is? People go, yeah. And most people like Medicare. You go, all right, now, we're going to take Medicare, and we're going to expand it, and we're going to improve it. We're going to cover everybody. You're not going to have to wait until you're 65 to qualify. You're going to qualify at birth, and it's going to go all through your entire life. And every medical necessary service or procedure is going to be covered. No deductibles, no copays. That's the improved part of Medicare. We're going to add dental to it, long-term care, and we're going to take the power of the federal government to buy drugs so we can lower the price of pharmacy. That's the whole idea behind single payer. Medicare will be celebrating its 44th birthday on July 30th. On July 30th in Washington, D.C., Healthcare Now is sponsoring a rally in Upper Senate Park, where we want to get as many people as we possibly can to go out and celebrate Medicare's birthday. A uniquely American solution, a cost-effective solution that basically carries an administrative overhead of 3 to 5% rather than 28 to 32%, and delivers care, not gatekeepers and locked doors to care. Every 32 seconds, somebody in America goes bankrupt because they can't pay their medical bills. Now, most of those people going bankrupt, they own houses and they had health insurance. But as I said, insurance is not health care. Right. And when we pay for health insurance, we are paying for services that in the for-profit world of the healthcare industry, they make their profit by making sure we pay, but we don't get it. All right? So that was my quick little thing. So hopefully you'll join us July 30th.